CNA Practice Test 60 Questions Full-Length Practice Exam. Question 1. The CNA is aware that the long-term care resident may resort to manipulation of the staff. The CNA recognizes manipulation as what behavior? Option A. Constant complaints of pain or discomfort each time a new staff member is on their unit. Option B. Lying to the other residents on their unit. Option C. Refusal to take medications. Option D. Sitting alone for all meals. The correct answer is option A. Constant complaints of pain or discomfort each time a new staff member is on their unit. Constant complaints of pain or discomfort each time a new staff member is on their unit. Question 2. It is estimated that delirium is noted in at least 40% of nursing home residents in the United States. The CNA is aware the resident with delirium might suffer from what symptom? Option A. A resident becomes tearful and upset at small changes in schedule. Option B. A resident sees or hears things that other residents and staff do not. Option C. A resident becomes weaker and experiences episodes of incontinence. Option D. A resident loses the ability to speak. The correct answer is option B. Residents see or hears things that other residents and staff do not. Residents see or hears things that other residents and staff do not. Question 3. A patient has fallen and broken his foot. The foot is now in a cast. What is important to assess during your shift? Option A. Color and temperature of the toes. Option B. Color and temperature of the knee above the cast. Option C. A pulse behind the knee. Option D. A pulse in the groin. The correct answer is option A. Color and temperature of the toes. Color and temperature of the toes. Question 4. You have a patient that has incontinence who wears briefs. What is necessary for patients with stress incontinence? Option A. A Foley catheter to keep the skin dry. Option B. A frequent toileting breaks throughout the day. Option C. Less fluids to keep them from urinating often. Option D. A diuretics to help keep their bladder empty. The correct answer is option B. Frequent toileting breaks throughout the day. Frequent toileting breaks throughout the day. Question 5. You have a patient that has fallen on the floor. What is the first thing you should do? Option A. Assess the patient for injuries. Option B. Leave the patient and go tell the charge nurse. Option C. Help the patient up to a chair as soon as possible. Option D. Make the patient roll onto their left side. The correct answer is option A. Assess the patient for injuries. Assess the patient for injuries. Question 6. What is the medical abbreviation for before meals and at bedtime? Option A. ACHS. Option B. BID. Option C. BM. Option D. BMAB. The correct answer is option A. ACHS. ACHS. Question 7. You have a patient on strict dysphagia precautions. The cafeteria sent her up a lunch tray. What item would you question if it arrived on the patient's tray? Option A. Regular orange juice. Option B. Mashed potatoes. Option C. Jello. Option D. Apple sauce. The correct answer is option A. Regular orange juice. Regular orange juice. Question 8. You have a patient with dark, amber-colored urine. You know this is a sign of what? Option A. Impending heart attack. Option B. Dehydration. Option C. Kidney stone. Option D. Impending death. The correct answer is option B. Dehydration. Dehydration. Question 9. You have a patient that does not drink adequate fluids. The patient is at risk for all of the following except: Option A. Mouth sores. Option B. Bad breath. Option C. Skin ulcers. Option D. Swollen gums. The correct answer is option D. Swollen gums. Swollen gums. Question 10. You are assisting a resident in shaving his face. Which of the following is a correct step in shaving the face? Option A. Shaving upward on the neck. Option B. When shaving the chin, an upward motion should be used. Option C. Use long strokes when shaving. Option D. Rinse the blade every 2 to 3 strokes. The correct answer is option A. Shaving upward on the neck. Shaving upward on the neck. Question 11. You have a patient experiencing dysphagia and must be on a dysphagia diet. You are assisting the patient with feeding. What type of diet would you expect this patient to be on? Option A, pureed. Option B, clear liquid. Option C, mechanical soft. Option D, irregular. The correct answer is option C, mechanical soft. Mechanical soft. Question 12. A patient's care plan states that he is a two-person assist and must use a Hoyer lift. Which transfer are you most likely making with the Hoyer lift? Option A, from the bedside commode to the chair. Option B, from the bed to the bathtub. Option C, from the wheelchair to the shower. Option D, from the bed to the stationary chair. The correct answer is option D, from the bed to the stationary chair. From the bed to the stationary chair. Question 13. A resident wants a copy of their medical records. The CNA should: Option A, make a copy of the record and give it to them. Option B, inform them that copies cannot be given to residents directly. Option C, notify the resident's family about the request. Option D, provide the record release forms and advise the supervisor. The correct answer is option Nan. Question 14. Two unmarried residents are cuddling in a common area. The CNA should: Option A, separate them. Option B, escort them to one of the residents' private rooms. Option C, notify their families. Option D, allow them to enjoy each other's company. The correct answer is option D, allow them to enjoy each other's company. Allow them to enjoy each other's company. Question 15. If another staff member hides the call bell from the resident who frequently uses it even though nothing is needed, the CNA should: Option A, be grateful because there is no time to answer the call bell so often. Option B, give the resident a fake call bell. Option C, tell the resident someone will visit every hour to see if she really needs something. Option D, return the call bell within reach of the resident and report the staff member for neglect. The correct answer is option D, return the call bell within reach of the resident and report the staff member for neglect. Return the call bell within reach of the resident and report the staff member for neglect. Question 16. One factor that can influence the grieving process is the cause of death. What impact can this have on the grieving process? Option A, the cause of death has no bearing on the grieving process. Option B, the cause of death brings up bad memories. Option C, death often reminds us of our past losses and how that individual passed. Option D, none of the above. The correct answer is option C, death often reminds us of our past losses and how that individual passed. Death often reminds us of our past losses and how that individual passed. Question 17. Your patient is nearing death and you notice they are grimacing a lot and look as if they are in pain. What can you do to assist this patient and relieve their pain? Option A, task the nurse to administer pain medications. Option B, do nothing as they are dying. Option C, place pillows around and under the resident. Option D, ask the patient what you can do to relieve their pain. The correct answer is option A, ask the nurse to administer pain medications. Ask the nurse to administer pain medications. Question 18. How many fingers should you be able to slide under wrist restraints? Option A, 1. Option B, 0. Option C, 2. Option D, 4. The correct answer is option C, 2. 2. Question 19. You have a 70-year-old patient that is usually pleasant and easygoing. Today she has cognitive delays, is hitting and kicking, and does not know who the staff are. Which condition is the patient likely experiencing? Option A, urinary tract infection. Option B, headache. Option C, sinus infection. Option D, hunger. The correct answer is option A, urinary tract infection. Urinary tract infection. Question 20. You have a patient with generalized weakness to transfer from the bed to the chair. Which transfer device do you use? Option A, Hoyer lift. Option B, the sit to stand lift. Option C, a sliding board. Option D, a gait belt. The correct answer is option D, a gait belt. A gait belt. Question 21. A resident states they wish their life would end. The CNA knows. Option A, elderly people say things like that and don't mean it. Option B, it is impossible to harm oneself in a long-term care facility. Option C, the resident needs help even if they don't mean it. Option D, your residents have the right to harm themselves if they want. The correct answer is option C, the resident needs help even if they don't mean it. The resident needs help even if they don't mean it. Question 22. You have a patient that only seems to become confused and agitated after dark. What is the patient most likely experiencing? Option A, a dementia. Option B, Alzheimer's. The correct answer is option Nan. Question 23. C is Sundowner's syndrome. D, psychosis. C, Sundowner's syndrome. You have a patient that had a fall. You must write an incident report. What is the reason for an incident report? Option A, to show patterns and trends and to prevent further incidents. Option B, to see who is at fault for the incident. Option C, to show the doctor how weak the patient is. Option D, to keep a record for the family members. The correct answer is option A, to show patterns and trends and to prevent further incidents. To show patterns and trends and to prevent further incidents. Question 24. Which of the following medical abbreviations is inappropriate for use? Option A, TID for 3 times a day. Option B, BID for 2 times a day. Option C, QD for daily. Option D, NPO for nothing by mouth. The correct answer is option C, QD for daily. QD for daily. Question 25. Which of the following is the best way to prevent the spreading of germs? Option A, wearing gloves during patient care. Option B, wearing a mask and gloves with patient care. Option C, hand washing before and after patient care. Option D, wearing a gown, mask, and gloves while performing patient care. The correct answer is option C, hand washing before and after patient care. Hand washing before and after patient care. Question 26. Which of the following happens when a patient has a stroke? Option A, the patient urinates themselves. Option B, the patient may foam at the mouth. Option C, the patient may roll their eyes back. Option D, the patient may have drooping of one side of the face. The correct answer is option D, the patient may have drooping of one side of the face. The patient may have drooping of one side of the face. Question 27. The patient that is B-bound is at risk for which of the following? Option A, dysphagia. Option B, polydipsia. Option C, atrophy. Option D, impaction. The correct answer is option C, atrophy. Atrophy. Question 28. You have a patient in restraints. You know the proper place to always tie restraints to is where? Option A, the bed frame. Option B, the upper bed rail. Option C, the lower bed rail. Option D, the head of the bed. The correct answer is option A, the bed frame. The bed frame. Question 29. Which of the following would require contact precautions? Option A, TB. Option B, COVID-19. Option C, pneumonia. Option D, MRSA. The correct answer is option D, MRSA. MRSA. Question 30. You have a patient who is sweating, has a low heart rate, fruity smelling breath, and can barely speak to you. What is the next step you would take? Option A, obtain a POC glucose. Option B, bring the patient 24 ounces of orange juice. Option C, turn the air on in the patient's room. Option D, ask the patient to brush their teeth. The correct answer is option A, obtain a POC glucose. Obtain a POC glucose. Question 31. You are using a pulse oximeter on a patient. You know a pulse oximeter is used to measure what? Option A, the amount of O2 in the patient's blood. Option B, the amount of CO2 in the patient's blood. Option C, the amount of CO2 in the patient's lungs. Option D, the amount of O2 in the patient's heart. The correct answer is option A, the amount of O2 in the patient's blood. The amount of O2 in the patient's blood. Question 32. You see your diabetic patient is sweating, disoriented, and unable to speak. What is the first thing you would assess? Option A, temperature. Option B, pupil. Option C, pulse. Option D, glucose. The correct answer is option D, glucose. Glucose. Question 33. In relation to the recent outbreaks of COVID that have affected long-term care facilities, the CNA is aware that what problem has acutely risen with the residents? Option A, of feelings of isolation from family and friends. Option B, feelings of worry related to death by COVID. Option C, feeling scared because the staff is in isolation attire. Option D, feelings of anger about not understanding COVID precautions. The correct answer is option A, feelings of isolation from family and friends. Feelings of isolation from family and friends. Question 34. Which of these are important for the care of a diabetic patient? Option A, giving the patient a heating pad for his feet when they're cold. Option B, soaking his dry calloused feet in a warm tub daily. Option C, keep his feet dry and warm with dry, clean socks. Option D, ensuring his toenails are always clipped short for cleanliness. The correct answer is option C, keep his feet dry and warm with dry, clean socks. Keep his feet dry and warm with dry, clean socks. Question 35. What is the proper measurement for measuring bodily fluids? Option A, ounces. Option B, liters. Option C, milliliters. Option D, fluid ounces. The correct answer is option C, milliliters. Milliliters. Question 36. You have a patient that has pneumonia and is weak. What teaching would you provide to the patient? Option A, make sure to cough and deep breathe often throughout the day. Option B, be sure to keep your liquid intake to 600 cubic centimeters per day. Option C, be sure to exercise your arms by doing range of motion multiple times a day. The correct answer is option A, make sure to cough and deep breathe often throughout the day. Make sure to cough and deep breathe often throughout the day. Question 37. A client has a confirmed case of influenza. The CNA would anticipate using which infection control precautions when caring for this client? Option A, contact precautions. Option B, respiratory precautions. Option C, reverse precautions. Option D, bloodborne exposure precautions. The correct answer is option B, respiratory precautions. Respiratory precautions. Question 38. You have a patient in soft wrist restraints. You must check the wrist restraints per the doctor's orders to ensure the patient's safety. Failure to do this can result in charges for Option A, neglect. Option B, aiding and abetting. Option C, false documentation. Option D, incidental harm. The correct answer is option A, neglect. Neglect. Question 39. The CNA measures the blood pressure of a client to be 200/180. The client is not in distress. What should the CNA do next? Option A, ensure the blood pressure cuff used is the correct size and repeat the measurement. Option B, record the measurement in the record and continue with the assignment. Option C, immediately notify the nursing supervisor. Option D, measure the client's temperature and pulse to complete the vitals set. The correct answer is option A, ensure the blood pressure cuff used is the correct size and repeat the measurement. Ensure the blood pressure cuff used is the correct size and repeat the measurement. Question 40. You have been busy during your 12-hour shift and haven't been able to empty your patient's Foley bag. You go in right before your shift is over to document output. What output amount would bring caution? Option A, 1000 ml. Option B, 600 ml. Option C, 2100 ml. Option D, 350 ml. The correct answer is option D, 350 ml. 350 ml. Question 41. The CNA is aware that attention-seeking behaviors in the nursing home resident may include all of the following except Option A, going to every social event in the nursing home. Option B, refusing to visit with their family. Option C, excessive use of the call light. Option D, refusing to go to therapy. The correct answer is option A, going to every social event in the nursing home. Going to every social event in the nursing home. Question 42. The CNA is aware of common mental health issues that are experienced by elderly adults. These may be brought on by all of the following situations except Option A of the death of a spouse, Option B loss of financial independence, Option C increasing health issues, Option D of faith-based group activities. The correct answer is Option D, faith-based group activities. Faith-based group activities. Question 43. You have a patient who is incontinent of bowel and bladder. You know this patient is at increased risk for what? Option A, pressure wounds. Option B, dehydration. Option C, depression. Option D, anxiety. The correct answer is Option A, pressure wounds. Pressure wounds.